So one of the things that like I noticed recently, now that I've lost weight, I can walk further. I can do a lot of things. But here's the problem. I had when I was 14, I tore my ligament, and at the time, my ACL. And at the time, the surgery, like apparently they couldn't do it. They couldn't do the ACL reconstruction because I was still growing. Mm-hmm. So over the years, from like 14 to like 21, my knee had given out a bunch of times, which then just the cartilage just got torn up, right? Until one day, I just couldn't even walk anymore, and I was like, all right, I guess I'm gonna have surgery now anyway, because I just had given up sort of, like I kind of got used to it. Mm-hmm. Long story short, now I've had this surgery, it's been over 20 years. I don't do anything crazy, I don't want to hurt myself, right? But I started feeling some really, like a lot of pain, and I went to the doctor, to this like sports medicine clinic, and what they said was that the problem is that I have a lot less cartilage in there, and then they took an x-ray, and this bone started growing down, kind of like to replace, the way they explained it to me was to like replace the missing cartilage, right? Mm-hmm. And so this is kind of what I'm nervous about, you know? What are some of my options?
Well, let's talk about what's causing the problem in the first place and how the history of this injury has brought you to where you are today. So what we see in our practice a lot are patients that were active young in sports, oftentimes a lot of former high school and college athletes that have had a lot of wear and tear on their body when they were young, or have had a joint injury like you had. So what happens when you have a ligament tear or either a bad sprain or a ligament tear in a joint like your ankle or like your knee is that it will change the alignment of that joint. So the ligaments, when you're forming, when you're growing, the ligaments will either loosen or tighten up enough so that you're getting the right motion in the joint. It's almost like having a glove formed to your hand. What happens is that when you sprain it or you tear it, it gives it what's called laxity, and it starts to move not exactly in the right motion. And over years of moving not exactly in the right motion, it creates wear and tear on the joint. And the wear and tear on the joint produces inflammation in the joint. And so that slight wear and tear over time will cause chronic inflammation. Now it's a low level because it's still, everything's still working right, it's just not moving like it used to. And that low level of inflammation that's caused by that wear and tear on the joint will start to degrade the cartilage, because it's like having a corrosive agent that's mildly corrosive on a surface over a long period of time. It's just going to start to wear it down. And so finally you get to the point where it's worn down so much that you're starting to experience pain because that cartilage has worn off the area that it's protecting, which is the bone underneath it. And once you start to feel that, then that's really a sign. That's what triggers people to come in and seek advice. So what I've just described to you is describing degenerative arthritis. So that wear and tear over time caused by the inflammation, that wearing down of the cartilage is degenerative arthritis. And you see it on an x-ray as a decreased joint space or roughened edges around that joint space that's decreased. And so really the primary culprit, the original cause of all that is the chronic inflammation. So a lot of times you'll hear an orthopedic doctor use the terminology bone-on-bone arthritis.
Right.
A lot of people have heard of bone-on-bone arthritis. It's misleading to call anything bone-on-bone arthritis. If there was truly no cartilage in there and it was literally bone-on-bone, your body would grow it together and cause it to become one continuous bone. I mean, that's what your body does. When a joint's not moving, your body will harden it and start to fuse it. So if you can move it just like 5 degrees in each direction, we know that it's not fused. We know there has to be cartilage in there. Otherwise, if it were true bone on bone, your body would grow it together. So as long as there's some cartilage in there, we can use stem cells to regenerate that cartilage and have it regrow over that area. So for example, when we treat a knee with bone-on-bone arthritis, first we make sure that there actually is cartilage in there and that it is a true bone-on-bone. I can say that I've never seen true bone-on-bone arthritis. The stem cells will cause the cells of the cartilage to stop producing the inflammation. So that little bit of irritation, that's chronic inflammation, that's caused by there being physical irritation of the cartilage and the cartilage cells producing chemicals that cause inflammation. Now the purpose of that is to signal to your body that it needs to be repaired. The problem is in a knee joint, the cartilage doesn't have very many, or doesn't really have at all, any blood supply. So your body can't regrow it. So you have this continuous inflammatory signal. It's like your cartilage cells saying, we need help, we need help, we need help. And no help is able to come because of the blood flow situation. So that chronic signal of inflammation is what causes the degradation of the joint. So what the stem cells will first do, because we'll inject the stem cells directly into that joint space, the first thing that they do is they shut down that production of that inflammatory signal. So the inflammation stops. And once the inflammation stops, then it's in a situation where it can start to heal. So no healing can happen until that inflammation is eliminated. And so because we're adding stem cells directly into that area, the stem cells also signal to the cells of the cartilage to go back into a growth phase as if you're just developing again. So then all of a sudden those stem cells cause the cartilage cells that are been degraded to start laying down more layers of cartilage until it reaches a maximum density, and then the genes in those cartilage cells shut off, and then you have a regenerated joint. Now it's not going to be regenerated to the point where you were a teenager, but it is going to regenerate that cartilage enough that you have a new smooth joint surface, the pain is gone, and the function is restored, which is ultimately the goal.
Interesting.